According to a recent study done in Texas and released in 2016, the use of a tourniquet in a trauma patient in the pre-hospital setting, meaning with first responders and civilians placing the tourniquet, the mortality has been reduced sixfold. Tourniquets are extremely easy to use, and they do a lot in saving lives. It is important for everyone, including civilians, to know how to use a tourniquet, almost as important as CPR, I would argue. As a paramedic, I've seen good and bad uses of a tourniquet, and then I've also seen people bleed out in less than 5 minutes when a tourniquet was not placed correctly. How to use a tourniquet and when to use a tourniquet are important parts of putting the tourniquet on, and we're going to go over those a little bit today. When you're going to use a tourniquet, you want to keep in mind a few things. The first important thing to keep in mind is you need to assess what kind of bleeding they have. If the injury is bright red and spurting, it's an arterial bleed. And if the injury is dark red and oozing or kind of gushing, it's a venous bleed. In the venous bleed type of injuries, direct pressure should suffice in stopping the bleeding. In the arterial bleeds, you're going to need a tourniquet to stop it. And you're going to need to place a tourniquet quite quickly. Other things to keep in mind when you're placing a tourniquet. You want to make sure it's on the upper part of whatever extremity the injury is on, your upper arm or upper leg. You never want to go on the lower parts because there are two bones in the lower parts of your arms and legs, and the strength of the tourniquet can compromise the strength of the bones in that part of your arm or leg. You also want to make sure the tourniquet is never over a joint. The bending of the joint will compromise how strong the tourniquet is, and the tourniquet will not be effective. And you want to make sure that the tourniquet, when you place it, is at least 3 inches above the injury itself. When the person is injured, at the injury site, there are a lot of tissue under there that you can't see that's also injured. So putting it above that will reduce injury. We're now going to go over how to use a tourniquet, so I'm going to ask AJ to come up to help demonstrate. One of the types of tourniquets that are out there is called a cat tourniquet. There are other types as well. Another type that you might see is a zip tie. It looks very similar to a zip tie. And you can also use other things that you find, including your belt. If you're wearing a belt, that can be effective as a tourniquet. You never want to use things as thin as a shoelace because it can damage the tissues more than it can stop the bleeding. So AJ, can I borrow your arm? Okay. So this tourniquet is Velcro, and the Velcro will make it so it doesn't slip when it's bloody. And you're going to put it as high and as tight as you can on the arm or leg, and you're going to pull it tight. Okay, you get the part is the stick. The stick is going to be turned at least 3 entire turns. There's 1, there's 2, there's 3, and then you're going to try to secure it in the bracket, and then over that you're going to put the white piece of Velcro. The white piece of Velcro is very important because it's where you know the time the tourniquet was placed. And the reason this is important is because there's only roughly 6 hours, depending on the study, that the surgeon has from the time that the tourniquet was placed until the tissue in the arm is dead and has to be amputated. Okay. Can I borrow your leg?
Yep.
Okay. If you're doing it on the leg, you want to make sure, again, you go over the thigh. Your phone's in your pocket. Can you pull that for me, pretty please? Thank you. Again, you want to pull the Velcro as tight as possible. Turn the stick 3 full turns. Secure it. And then the band. And then one other thing you want to look at or pay attention to when you're doing this is you want to make sure the injury itself has stopped bleeding or is at least slowed down significantly. That'll tell you how tight the tourniquet is, and you want to make sure that the blood flow is stopped to the injury. So, in conclusion, now that you know how to use a tourniquet, I challenge you, if you're ever faced with a situation where a tourniquet might be needed, to step up and accept the challenge and put the tourniquet on to possibly save that person's life.